All right, so we're in a potentially interesting part of this protocol, which is what are some of the fun toys I get to enrich my post-surgical life with? Now, what we're gonna try to do here is show you that there's a whole spectrum of gadgets and ideas that all do the same thing, that can be kind of broken down and boiled down into two categories. One, does it help improve blood flow? Does it help me manage congestion? And in that management of congestion and swelling, that I may have less pain, et cetera, et cetera. And secondarily, how do I sort of become more normal in my training? So again, how do I manage blood flow and swelling? Secondarily, how do I keep myself intact? So at the end of my healing phases, I'm actually ready to go back out into the world and not begin from scratch, from zero. So let me talk you through this and just keep the caveat that, remember, your body's a perfect, amazing healing machine. And it's either gonna heal at the rate of a human being or less fast. And even if you didn't have access to any of these things, you're still going to heal. But what we're trying to say is, hey, what's available to me to lessen my suffering, lessen my discomfort, and to facilitate the maximum healing response? Again, there's a spectrum on terms of things that I can afford that fit into my budget, and some things that we think that are just big bangs for the buck that are worth it, but simultaneously, if I can't afford it, what do I do then? So we'll start on this end, and what I just want to show you is that this is a Normatec compression pants, which has come out of sort of our high performance environment, which is basically I put this pant leg on or an arm on or a hip compression, and I get sequential compression of air tubes, which helps squeeze the lymphatic system, helps to manage the interstitial space, the spaces in the tissues, so that it can help decongest the body. They're fantastic. You get to be passive and lay there and just pump away. And what's nice, again, about something like the Normatec is that, again, you can carry that right back into your normal life. I originally became aware of this over a decade ago in work with our Tour de France athletes. It's one of the ways that they were able to handle higher training volumes by facilitating that decongestion. In the decongestion category, we have this H-Wave device made by our friends at H-Wave. Again, we've been working with this company for over about a decade. And this device does two things. Instead of mechanically compressing the tissues down, the H-Wave can give us some input by causing our own muscles to contract. So this isn't TENS where you feel a buzzy on the skin. This is a waveform that causes a big, solid, but non-fatiguing muscle contraction. So we think about the lymphatic system as the sewage system of the body, and especially around joint surgeries, it's the deep lymphatics that drain the joint. It's not the circulatory system of the little capillaries around that would bring blood to the musculature. It's the system of the sewage drains in your body that ultimately all dump back into your heart. So your body naturally creates about 3 to 4 liters of lymphatic fluid a day. That's just the normal process. And in surgery, sometimes that can be accelerated, and that swelling is a big deal. So one of the reasons we love this is with this low frequency setting. We'll show you how to use this. We can get this non-fatiguing muscle contraction, we get movement in the system. It's very powerful. We love this, and it's part of all of our protocols. The H-Wave also has a high frequency setting, which allows us to change the input so that we can get some on-demand and lasting pain relief. So it's a non-drug pain relief. By putting some energy in, we can fatigue out some of the perceptions of how your brain is perceiving what's going on in the local tissues. So you'll see, again, we're huge fans of the H-Wave. You can even stack these two things and pump and compress. It's pretty bonkers. Now, let's say I didn't have access to these two things. There is something called elevation and compression. And a good old-fashioned voodoo floss band. This is the TRS voodoo floss band. We pioneered voodoo flossing. And this is just a really nice kind of latex rubber band. I can wrap the joint, wrap the tissue. And what we tend to say with our athletes who are in austere places or can't afford this or don't have access to this because of where they live, that a voodoo band wrapped 30 times a day can be really, really amazing in terms of high-level intermittent compression. It can also be doubled down to be used for something called blood flow restriction, which we'll talk about in a second. But again, this is a $10 option and very, very effective. As we're looking down the sort of pantheon of things that are available to me, again, sort of going in price and efficacy, having access to a percussion device can be really nice, because a lot of times what ends up happening is that we are, really trying to unload a tissue, unload a movement system, unload a limb so that we don't overstrain it as those tissues are setting up. But then the well body side and the rest of the limb, the rest of the area can definitely feel achy. And having access to a percussion gun is very nice because you can hit the spots that are feeling sore or that are having to work hard to weight bear, or if you're not able to move because you're trying to protect a surgical repair, sometimes being able to have some movement in the system just through the vibration can make it feel better. And it's a way of addressing some of the musculature. And again, just a wonderful self-soothing technique if that's available to you. This is a simple cup, like cupping the good old-fashioned Chinese cupping style. This is just a really simple silicone one off of Amazon. They're a few bucks. And one of the reasons we like these, they come in big kits, is that you can then create a lot of movement and shear around an area without having to put in a lot of mechanical compression. So you could put it on, get some blood flow in an area. It's so easy. You can even apply it in water. But what ends up happening is this low pressure system underneath the cup allows me to create rotational shear and movement and just to keep tissues sliding. We can also get blood flow back into areas that may not have as much blood flow as they normally have because we've disrupted those capillary beds. It's easy to work over scars and is a wonderful, wonderful, very inexpensive tool. The gua sha is a scraping device. A spatula works, a scraping device off Amazon works. This is the leopard claw, but even a butter knife can be really great about desensitizing and working those other areas, especially once the incisions are healed. A lot of times when people come in after these old surgeries, the incision feels like it's tacked to the surfaces, and getting these tissues to slide and glide around it is part of taking that tack, that pin out of those sliding surfaces. So gua sha is a really, really simple technique to work in tendons and ligaments, a little scraping. Again, we'll show you that, but very, very simple. And then we start to move into the training side of things. We're enormous fans of this technology called blood flow restriction training. This is a cuff made by our friends at Occlusion Cuff, and it's really simple. They go really up in price as soon as you start adding technology, remote pumps and things. But basically, the occlusion therapy is probably the best, well-studied therapeutic intervention out of all of the rehab physical therapy interventions. It's been in Japan for decades. What we've found is that we're able to train normal movements or even rehab-based movements so we can use very low loads and low intensities. But with the occlusion, and it's not even occlusion, with the restriction of blood flow either at the hip or high up at the shoulder, we're able to actually signal a whole bunch of really interesting changes, where we're able to have similar changes in collagen, similar changes in muscle mass that would be sort of commensurate with using very large loads and high intensities. But since the tissues can't handle these high loads, high intensities, because they're in surgical repair, BFR is great. In our protocols and in the athletes we work with, you get it 1 or 2 times a day post-surgery, and it's pretty gnarly. But we'll show you how to use that. Again, a voodoo band can be a surrogate wrapped appropriately, but an occlusion cuff, or this is made by Occlusion Cuff, but BFR cuffs are very nice. And then lastly, we are huge fans of a lot of Zone 2 aerobic work, and trying to keep activities that allow us to maintain our aerobic fitness, maintain our blood flow, and increase that non-exercise activity. What we actually see in traditional rehab models is that people become highly deconditioned in and around surgery or trauma. And what we're looking at is trying to protect and systematically load the tissues that have been repaired, but keep the rest of the system as sharp and as hot. And we actually like to return some of our athletes to better conditioning after their surgery. So what's nice about having access, this is the Rogue Echo bike, and one of the reasons we're huge fans of these arm leg bikes is that we can always use 3 limbs. So if you're locked in a sling and trying to protect, we can still do a lot of well body work, improves blood flow, reduces sort of disuse atrophy, which is a model that happens when our bodies basically start kicking out these structural proteins. As soon as we stop using them, we lose our muscle mass. But you can also just go slide one of your legs and do one leg, 2 arms. It's terrible and horrible, and people are really glad to get off the Echo bike at the end of their rehab process. A lot of people end up buying one, putting it in their garage and using it. We are able to, again, if we're looking at the healing times for some joint replacements and some ligamentous replacements, can be upwards of 12 weeks. So having a simple go-to system to manage some aerobic work and then to challenge some of your rehab. So you can take some of the rehabilitative exercises, low-level scale exercises. You can do BFR with it, or you can do a little bit of an interval and then do that really simple tempo, slow squats or whatever movement you're doing that your rehab provider has provided for you. So it's a way of challenging some typical rehab and keeping you back in the game quickly. The last thing I'll say is that if you don't have access to this or this isn't part of the budget, go to your local gym, find out if they have one or they have the budget for one, if you're at a sort of a more industrial global gym-like system. But the idea is if that's where it is, then 3 or 4 days a week, you can go down there and use that thing even during class time. So again, here we have the sort of spectrum of ideas, decongestion, tissue sliding, right? Neuromuscular reeducation back into training and loading the tissues appropriately.